So why do both patients and doctors have such negative opinions about medical health insurance companies? Well, here's a great example. I tried to get pre-authorization for a breast reduction for a patient of mine. She has significant back pain, neck pain, rashes underneath her breasts, which are common from having very large breasts. To give you an idea of how large her breasts were, they required a double J cup. That probably means that her breasts are 4 or 5 pounds on each side, the size of a pretty decent sized watermelon on each side, in terms of giving you an idea of what it would appear like. We sent photos, my notes from my office, a letter, and notes from her dermatologist. Took about a month to get a reply, and they denied it. So we requested a peer-to-peer review. And in a peer-to-peer review, you're getting someone on the medical side from the health insurance company. So there's already a negative opinion. They work for the insurance company. You don't know if they're a nurse, an internist, a plastic surgeon, which would be best to discuss that with, or some other field. So we had a conversation. The person on the other side, first of all, they required me to be available for 9 to 12 in the morning to wait for the call. If they said if I didn't pick up the phone, they would not have another peer-to-peer review, so I had to wait around for this call. The person didn't call. From that time period, we called the insurance company, and about 45 minutes later, this doctor called. We had a discussion, and she said, oh, well, the rashes may or may not improve. Why didn't this woman come sooner? I said she got denied several years ago, and she got upset with the whole process and didn't want to go through it again. They also asked me, what are her symptoms of thoracic outlet syndrome? I said I never said she had thoracic outlet syndrome, and it's very rare to get that. That's usually from impingement of the nerves or vascular system, either in the neck or from an aberrant rib in the armpit, which gives numbness in the arm, which we didn't say she had. But they're asking for very specific minutia kind of things. So this was denied, and now I'm waiting to waiting to have a peer review by someone in my field. So at least a plastic surgeon will look at this. But I wouldn't be surprised if, for whatever reason, it gets denied. But this is the frustration both doctors have and their patients have to be able to get general medical care. What do you think?